And I put the link for this PowerPoint in the chat, so you can follow along. If you follow along with the PowerPoint, you have that link to access. Um, so here we go. We're going to move from the blood into the heart, and with the heart, we certainly all have some idea of maybe where it's located, maybe even that it is some sort of a pump. So you're probably coming in to this course with at least some basic knowledge of the heart. It's located somewhere in the chest cavity or in the thoracic region, and you know that it's a pump. I think we could probably safely assume that. Now, it's a little bit more complicated than that. Not much. So, that's it. Done for the day. Heart is a pump. It's located in your chest. Have a good weekend. If only, right? Well, we have to add a few more things to it, of course. So it's a powerful pump, and it's a pump that's working every second of every minute of every day of your lives. And we could assume then it's probably pretty strong. It's probably pretty muscular. So we'll look at some of those features as well. We've already seen a little bit with the heart, going back to tissues. We looked at muscle tissue and cardiac tissue being a specific type of tissue. Now, as we go through this PowerPoint today, and as we go through our discussion on Chapter 19 and OpenStax, you're really only going to be in section 19.1. Okay, so that chapter is pretty massive, but 19.1 is the only spot you need to be in. Okay. After that, 19.2 on down the line, that's all physiology. We're going to revisit this chapter quite extensively in one of our stops next semester in advanced. Okay, so keep that in mind as well. Our focus really, again, is just on 19.1. What are the basic structures of the heart? So anyhow, we take a look first at the kind of the location of it. We've seen this before in a little bit of detail. We had that thoracic cavity that, again, going all the way back to week 1. Within that thoracic cavity, we had this kind of central mediastinum region. So that's what that kind of hash marked line that we see here. And then there's the term there, mediastinum. So that, let me get my pointer out. So mediastinum, again, you've seen that term before. Again, it's basically a region, kind of a sub-region, I suppose, within the thoracic cavity. And that mediastinum, media, right, means down the middle. Stinum probably sounds a lot like the word sternum. So pretty safe bet that we're right around the sternal area when we see the term mediastinum. Because that's really the name of the game, right? With A&P is seeing terms, being able to break them down a little bit and conclude through problem solving and critical thinking skills, and of course your memory of where you've seen these before. But also when you are faced with a term, you're getting so many terms, right? The semester's been full of them. We're going to be giving you a bunch more here over the next 4 weeks. So again, don't forget that it's important to see more than just the word and the letters, but seeing the bigger picture of being able to break the word down into parts. And then from those parts, you can deduce a lot of things regarding the structure. So mediastinum is another example of that. So anyway, within that region or that kind of sub-region or mediastinum area, we certainly are going to see the heart and some of what we call the major vessels of the body and major vessels of the heart itself. So we also see a couple of other items in the mediastinum in the next unit. In unit 9, we're going to look at respiratory a little bit. So we'll talk about the trachea. We're going to look at, and you can see the trachea trachea just a little bit right here, and then we'll certainly talk about the lungs. But mediastinum wise, we're going to look at the trachea and then the beginnings of those bronchi, or those large branches off of the trachea, kind of hidden behind the heart right now. And then just inferior to that, just posterior to the trachea, we're going to see the esophagus in the digestive tract. So there's more to the mediastinum than just the heart and the great vessels of the heart. So my point is, we'll see it again in about 2 weeks. So anyway, back to the heart itself. We look at its location, pretty centralized in within the thoracic cavity and that mediastinum area. We do notice just upon first glance, and again, I know this is an illustration, but it's pretty close to what we would normally see in a gross anatomical aspect. But you do notice maybe right away when you just look at the heart, and its positioning and kind of its general structure, we see that the left side, and again, we're looking at the correct anatomical position, the patient's viewpoint. So this is the left side. Okay, and this is the right side. So the left side of the heart does appear to be a little bit larger. It maybe even seems like the heart takes up a little bit more room on the left portion of the mediastinum. You could even see that hash line kind of veering more over to the left than we see over on the right side. So that's something you maybe notice at first glance. The heart is a little bit left of center. We also notice, kind of as a side note, and as a result of this heart being a little bit left of center, as we see the left lung is a little bit smaller than the right lung. So let's see that again. So keep that in mind when we get to the respiratory system. And we do discuss the cardiovascular and respiratory kind of piggybacked, because we really are introducing you to the respiratory system now. The idea of the heart as a pump is not just to pump blood out to the body. We certainly need blood going out to the body, especially the brain, right? We also are going to see the heart pumping blood to the lungs. So that's kind of the dualistic aspect of the heart as a pump. It has, we look at it as being divided up into two halves, or two sides, even a left side and a right side. So we'll keep that in mind as we go. And as we kind of segue into discussing that kind of lung or respiratory connection with the heart, uh, we do see a color difference going on regarding these blood vessels. And I think I probably mentioned this several chapters ago, that when we've seen some of these colors, blue generally meaning that we have low oxygen blood. So when you see blue vessels, blue tubes, the blood inside of those tubes is going to be low in oxygen, oxygen deficient. Okay. When we see these red vessels, the opposite gas is going to be in charge here, and that's the oxygen level. So oxygen gas is going to be high when we're talking about red colored vessels. So that's another, I think, maybe kind of striking feature of what we see on this slide. Is we've got lungs involved, we've got the heart, the mediastinum, a little bit left of center with the heart, but then we have these big red and blue vessels involved as well. So these are going to be vessels that are delivering blood either to the heart and then to the lungs, or vessels that are delivering blood from the lungs back to the heart, and then the heart out to the body. So as we kind of move forward here and start analyzing the heart and breaking up some of its microstructural features, we're going to see that we really look at it as a right side of the heart and a left side of the heart. Okay, so the right side of the heart is going to be associated with the blue tubing. Okay, so the right side of the heart is going to be associated with low oxygen blood, or receiving low oxygen blood and then sending that low oxygen blood out to the lungs. So you kind of as a, and yeah, again, you probably know this already, but the lungs deal primarily with oxygen and carbon dioxide gases. So the idea is we need oxygen to travel throughout the body and get to our cells, primarily the mitochondria of our cells, right? Well, one of the waste gases we know is carbon dioxide, and we've looked a little bit at pH and a little bit at blood last time we were together, and the importance of getting rid of carbon dioxide, for pH reasons and a variety of other reasons. So the lungs are going to be the key kind of players or components when it comes to gas exchange, when it comes to exchanging oxygen in and carbon dioxide out. So the heart and the rest of the body I should say, the body relies on the heart to be able to pump blood to the lungs that needs oxygen, and then subsequently pump blood out to the body, to the parts that need that oxygen. Okay, so we're dealing with carbon dioxide out of the body, oxygen into the body. How does all of that happen? Well, the respiratory system does the basic exchange of the gases, but it's the cardiovascular system that's going to drop off the groceries at the body cells, pick up the garbage at the body cells, and then bring that garbage back to the lungs so the lungs can expel that garbage, that carbon dioxide waste, and then bring in the oxygen and give that oxygen to the red blood cells so then they can again travel throughout the body to drop that oxygen off. So the heart's kind of the middleman, and they're the middle person. You got to be a middleman. That's probably out right now. It's middle individual, middle person, right? So anyway, the heart is the kind of that cog in the middle. It's where everything has to get pumped either to the lungs or to the body. Okay, all of the blood needs to be moving, and if the heart's not pumping, the blood's not moving. And what that means is oxygen isn't getting delivered, carbon dioxide isn't getting brought to the lungs, and that's a problem. That's a big problem. So, so anyway, that kind of this introductory slide got a lot of verbiage. There's all kinds of terms. So we're going to look at those now, kind of breaking them down individually. Um, the other thing I wanted to point out, and this is something we're not really going to do anything with this semester. It's not in our objectives from WIDS, it is in our objectives in advanced. And that has to do with what we call the coronary circuit, okay? The heart or the cardiac circuit, okay? So you can see there are blood vessels around the heart, okay? This is how the heart gets fed. Makes sense, right? We have to feed the pump. So the heart muscle has its own kind of network of blood vessels. We'll look at those briefly, but next semester we're going to go through how the heart gets fed. So you've probably heard of them, like coronary arteries, right? Somebody maybe had bypass surgery, or had maybe had a heart attack, or the high cholesterol. These are the spots that the cholesterol is clogging. So if the heart muscle isn't getting fed because the tubes that bring the food are clogged, then we have to do a bypass. We have to bypass the clog and get a new vessel, or basically a new transport pathway to be able to feed the heart muscle. Okay, so like a triple bypass or quadruple bypass, that's going to imply that we have three or four or quintuple bypass, five of these are clogged. So, so anyway, we're not going to get too much into detail with the coronary arteries and the cardiac veins. Okay, next semester we'll get more into detail with those. What else do you guys notice? Maybe some of the yellow around there. Remember, yellow's indicative of fat, so we do see certainly quite a bit of fat around the heart. Fat's a great insulator, but it also has a lot of stored energy. Okay. And again, I'm not going to go through these terms right now. I've discussed a couple of them, but really just kind of the introductory. Here's the heart. Here's where it sits. Now, there's one other item of note that maybe you've noticed at the bottom. Not only do we see the diaphragm here, right? That muscular wall that distinguishes the thoracic from the abdominal cavities, but we also see this connection with the heart and diaphragm. There's a layer of tissue here that's going to be part of what we call the pericardium. Okay, pericardium. And here's the term pericardial cavity. So we'll keep that in mind as well a little bit as we go through some of these structural features, that the heart is connected via that pericardium to the diaphragm. So, and again, we think of the diaphragm as being a major player in the ability to bring air or oxygen into the lungs. The other thing we'll see in a couple of weeks with respiratory is the inferior surfaces of the lungs are actually surrounded with a double membrane. And that membrane, that outer membrane, what we call the parietal membrane, is going to be connected with the diaphragm as well. So the lungs and the heart are linked to the diaphragm. So as the diaphragm kind of flattens out, the heart and the lungs are kind of coming with it. So part of that rhythmic breathing goes along with rhythmic heart rate. So there's, anyway, so that's what's going on there. A lot of action. So let's get into some of the more nitty gritty aspects. Before we do, there's a little section in OpenStax, kind of a clinical application section, talks about CPR. So if you are not first aid or CPR certified, you're going to have to be at some point. So, so anyway, check that out in OpenStax. There's a link in there too that takes you out to the American Red Cross, I believe it is. So anyway, there are multiple avenues of becoming first aid and CPR certified. But one of the items you'll learn is the tracing and then subsequent placing of the base of the hand or the palm area over the sternum, and making sure that we're doing our compressions in the proper location. So generally, we see between T5 and T9, and the posterior aspect is where we're going to find the heart. So out front, we would see the ribs coming out around T5, and then we kind of stay away from the xiphoid or xiphoid process. So kind of where those false ribs come in, and that cartilage, we're just a little bit above that. So really around ribs 5 and 6 and 7, we're going to see that the main body of the sternum, and where we're going to put the palm placement. Okay, so anyway, you'll take a CPR course if you haven't already. This is the diagram of circulation of blood, or the flow of blood through the body. Again, this is something more or less that we focus a lot on next semester when we do advanced or more functional features of blood. But again, you need to be introduced to the very basics of how blood flows through the body. And again, when we look at the heart, we see it as a dual pump. Right side of the heart, notice, is got all of the blue. So we're going to see blue blood, or low oxygen blood, coming from the body into the right side of the heart. We'll get into the specific chambers or rooms of the heart in just a few minutes, and then you can see we send that blue blood or low oxygen blood out of the right side of the heart, and it travels right over to the lungs. And then in the lungs is where we're going to see the gas exchange take place. So we're going to introduce oxygen into the bloodstream, and then we see the lungs sending the red blood or that highly oxygenated blood over to the left side of the heart. Okay, and so then the left side of the heart, and it's kind of hidden, but you can see right back here, all of a sudden we've got this big artery that appears. Well, that's actually connected to this left ventricle or this lower left chamber of the heart. So the left side is going to pump oxygenated blood out to the body. Okay. So again, don't, it's not, it is complicated. It doesn't have to be. I think if we just really look at the heart as the right side is getting all of the blue, low oxygen blood from the body and then sending it out to the lungs, then the left side is getting the oxygenated blood or the red blood from the lungs. And then that left side pumps that red oxygenated blood out to the body. And then you can see it's a circuit or a cycle. So you can see we've got kind of a superior circuit. So this blood, it doesn't show it, but this is the blood that's going to go to the upper body. So maybe the shoulders, arms, head. So a lot of the blood vessels we'll see next week that are coming from the top of that are coming from the superior aspects of the body, blood that's going up, back up to the upper body. And a lot of those blood vessels are going to be named for the regions that they travel to. So again, we'll keep that in mind as we go. Blood vessels mostly are going to be named for kind of their location or where they travel to. So then again, all of the blood coming from the inferior aspect or the lower part of the body, again, those blood vessels are all going to be named for where they're coming from or where they're going to. So we'll keep that in mind moving forward as well, because again, we are doing the heart today, but we have to discuss some of the vascular aspects as well, some of the blood vessels. I do want to mention at this point too that we are going to see we see it on this slide. So this is kind of the time to give you that brief, quick introduction to the terminology of the vascular aspects of the body. Okay. So, and again, they're all associated directly with the heart. So we're going to see what are called arteries and what are called veins. Okay. So we'll pretty much focus on those for right now. Okay. Arteries always go away from the heart. So any blood that's leaving the heart. So if it's leaving the right side of the heart, the blood that leaves the right side of the heart is leaving through an artery. Okay. The blood that leaves the left side of the heart is leaving through an artery. Arteries always away. Okay. That means veins always go toward the heart. So when we look at the right side of the heart, a couple of veins are going into the right side of the heart. We look at the left side of the heart, we'll see a couple of veins going into the left side of the heart as well. So veins are dumping into the heart. Arteries are pumping blood out of the heart. Okay. That's going to come into play a little bit more next week, but that's the basics of what separates an artery from a vein. Now, all arteries go away from the heart. Most arteries that are going away from the heart, if they're going away from the left side of the heart, okay, that blood in those arteries is going to be highly oxygenated and represented as being red. Okay, so you can see right here, this big blood vessel, this big artery sending red blood out. So all of this is going to be artery All of this is going to be artery, right? Arteries always away. Okay. For the most part, all of that arterial blood is going to be oxygenated. The exception is right here, right? We have blood that's leaving the right side of the heart. So these are arteries as well. Okay. So as we leave the right side of the heart, we're officially in an artery. And these are all going to be arteries here. They're going away from the heart. These are the only arteries in the body that are carrying blood that's low in oxygen. Okay. They call them the pulmonary arteries. We'll see, you can see the term pulmonary here. Okay. Pulmonary. Okay. So pulmonary arteries. Okay. So tells us pulmonary has to do with the lungs. Artery means we're going away from the heart. So it means that we have blood that's leaving the heart, going to the lungs in this particular vessel called the pulmonary artery, the only artery in the body that's carrying blood low in oxygen. Okay. So that means then vein wise, the only veins in the body. So look at most veins are going to be blue, right? They're bringing veins always go toward. So we see systemic veins or veins from the body coming to the right side of the heart. All those vein, all that venous blood is blue. We have one spot over here, right, where we're going to see venous blood that's going to be high in oxygen. And that's going to be the pulmonary veins. So pulmonary, lungs, veins toward the heart. So the veins from the lungs going toward the heart are going to be carrying oxygen, right? They're going to the left side of the heart. So the only arteries in the body that are low in oxygen, the only veins in the body that are high in oxygen, pulmonary. Okay, so again, we'll get into that more next week. We'll get into it again when we do respiratory the week after that. So again, if this is kind of sounding like a jumbled mess, totally understandable. If it's sounding just slightly confusing, totally understandable. We are going to be diving deeper over the next several weeks. Well, not several, 2 or 3. Don't really have several weeks. Next 2 weeks or so. And then, of course, next semester, it's kind of, we'll go back over this a little bit, but not much. We're going to be moving forward. So anyway, keep that in mind. Right side of the heart, low oxygen blood. Left side of the heart, high oxygen blood. Right side of the heart receives blood from the body, sends it to the lungs. Because the blood's low in oxygen, what do we do with it? We got to oxygenate the blood. How do we get blood to the lungs? We have to pump it. So right side of the heart pumps that low oxygen blood over to the lungs. Perfect. Lungs do their duty. We see what are called capillaries. That's the third vessel type. Capillaries are, and again, I don't mean to throw so much at you, but I mean, I guess I kind of do. Otherwise, I wouldn't. But anyway, uh, capillaries are the third vessel type. Capillaries are where exchange takes place. So generally, when we look at blood vessels, we don't really see blood leaving the vessel. We don't see, we shouldn't, right? An artery and a vein, blood needs to be contained in those vessels. It needs to be moving, but it doesn't need to leave the actual vessels. That's when we have a breach and we have to get the platelet plug, right? And fibrin and thrombin and you know, we get, that's a problem. So we fix it. Now, but we're transporting usable things, big things, nutrients, gases, chemistry, right? Hormones, enzymes. We're transporting a water. A lot of stuff is in the blood. How do we get it out of the blood? Capillary networks. Okay. The capillaries are the only place where we can get things out of the bloodstream. So this is where we find the tissue level. the cellular level, because ultimately, what is going on here? Why are we eating? Why are we drinking? Why are we breathing? Because our cells need to consume all of those micronutrients that we're providing, all of those groceries. How do we get those groceries to our cells? Through the bloodstream. But I thought we couldn't get anything out of the bloodstream. We generally don't want to, except at the capillary network, at the cellular level, at the tissue level. So when we see capillaries, we oftentimes see them represented as kind of blue and red meshing together, because it's where that arterial blood, that nutrient blood is coming in, and then we're dropping off all of the groceries, and then we're picking up all of the waste. Because cells, what are they doing? They're doing what we're doing. They're eating and drinking and consuming what we give them. And then there's chemical reactions that involve waste. So the venous pathway of blood flow is primarily there to pick up waste. So anyway, how do you get anything into the bloodstream? How do you get anything out of the bloodstream? At a capillary network. So when we move forward and we start talking about filtration mechanisms, like the kidneys, for instance, are major filters of blood. We'll see lymph nodes work on filtering blood. The lungs, in essence, are kind of exchanging gases, so there's some filtration aspects there. Your digestive tract, when you eat and food goes, somehow it gets into the bloodstream. Well, how do we get anything into the blood or out of the blood? Capillaries. So we can assume that our intestines are going to be full of capillaries. We can assume that the lungs are going to be full of capillaries. We can assume that the kidneys are going to be full of capillaries. The liver is a major filter, full of capillaries. We also find capillaries everywhere. I need to feed my skeletal muscles. I need to feed my skin. I need to feed my brain. I need to feed the tips of my toes and the backs of my heels. I need to feed every aspect of my body. And in order to do that, I need a vast network of capillaries. So anyway, we call them systemic capillaries and then pulmonary capillaries. Whenever you see the word capillary, it means there's exchange going on. It means arteries are coming in and veins are going out. Okay. So that's why this illustration and slide is up here, basically, again, to kind of continue the path of understanding why you have a heart and what its connections are to the vascular system, and certainly then to the rest of the body. So we call the systemic circuit the left side of the heart pumping blood out to the body, and then the body sending that blood back to the right side of the heart. That's the systemic circuit. And then the right side of the heart sending blood over to the lungs, and then the left side of the heart receiving that oxygenated blood back from the lungs. That's called the pulmonary circuit. Okay. So anyhow, let's look at some of the more specific uh, uh, structures and features of the heart. So we're going to start on the right side. We're going to look at the blue aspect, the low oxygenated blood aspect. So what we see, first of all, is a large vein bringing low oxygen blood from the superior portions of the body, the upper body. Whoa, back up. And then we have an inferior vein that's bringing blood from below the heart back to the heart. Okay, so below the heart, all the blood at that level is going to be brought back to the right side of the heart via the inferior vein. So we have a superior vein and an inferior vein. Specifically, they call them the superior vena cava and the inferior vena cava. So some say cava, some say cava. If we're talking about multiples, they say the vena cavae. an E on the end. Remember, if you have a word that ends in an A, you put an E on the end of it to make it plural, like a vertebra and a vertebrae and multiple vertebrae. So anyway, superior vena cava is the top vessel, inferior is coming up from the bottom. And where are these two veins dumping the blood into the heart? They're dumping the blood into what we call the right atrium. We already know it's going to the right side of the heart. We've already discussed this, that right side of the heart receives low oxygen blood from the body. Specifically, it's the right atrium of the heart. Okay, so we see that term there. The atrium is the upper or superior chamber of the heart. Okay, the right atrium. And then we have what's called a valve. A valve, this is probably one of the first valves I think we've really seen this semester. We're going to see valves more throughout the rest of the semester. So, this is, I think, really one of your first introductions to a valve. A valve prevents backflow. So, a valve is basically a series of different types of flaps or some sort of mechanism that's going to close to prevent backflow. So we'll see valves in your blood vessels. We'll see valves in the digestive system. So anyway, a valve prevents backflow. So when we have this blood in the right side of the heart, the right atrium, we need to keep the blood moving. So we don't want a backup of blood. So as soon as blood leaves the right atrium, it's going to pass through this valve called the tricuspid valve. And tri means three, right? Three, and cuspid means cusp. And a cusp is kind of like a flap. So it's kind of like a three-flapped valve, a tricuspid valve, and it's on the right side. It's going to open up, or in essence, like a trap door. So the trap door opens. There's some little strings that we'll see later that attach to that valve. But as that valve opens, blood is going to travel down into what we call the right ventricle. Okay, so the lower chamber, the inferior chamber, is called the ventricle. So right atrium through the tricuspid valve into the right ventricle. Okay, so we have our first two chambers of the heart, the atrium on top, ventricle on the bottom. A on top, V on the bottom. A before V in the dictionary. Okay. Atrium, ventricle. Now, we already looked at the valve that separates or distinguishes the atrium from the ventricle, specifically the right atrium from the right ventricle, calling it the tricuspid valve. All right. We can also call this the right, so on the right side, atrio atrium, ventricular, ventricle, valve. They'll even abbreviate it AV valve. So when you guys start working on some of your assignments, when you start doing your readings, when you watch any of your Padlet videos, you may hear the term AV valve or atrioventricular valve. That is simply the valve between the atrium and the ventricle. It's actually more, at least as descriptive as tricuspid valve. I think atrioventricular, right atrioventricular tells us everything we need to know. And valve, right, we're on the right side. Atrioventricular, we're between the atrium and the ventricle, and we have a valve. Okay, so a lot of times you're going to see, you're going to start seeing more and more in the clinical setting, right AV valve instead of tricuspid valve. You'll still see tricuspid. Okay, certainly, but I also want to mention that AV valve is the same thing, atrioventricular valve / tricuspid valve, right AV valve. tricuspid. There's an R and a T and an I in there, or a TRI or RIT. So the word right also has RI and T in it. So that's one way maybe to remember tricuspid is on the right side. Okay. Using like alliteration and word play and mnemonic devices and stuff like that. All right, so our blood, we're almost out of the right side of the heart finally. So the right ventricle, notice too, real quick before we leave the right ventricle, and again, this is diagrammatic, but it's a fairly decent representation in illustration. But we see that the muscle wall of the ventricles is represented as being much thicker than the walls of the atrium. So the right atrium wall, represented by pink, which is going to be the muscle. Okay, notice the ventricle is going to be thicker than the atrium. And part of the reason, the main reason, maybe the only reason, is because the ventricles are what do the pumping in essence. I mean, they're what have to pump the hardest because what's in the chamber has to go the furthest. So, yeah. So this blood down here has to get sent out to the lungs. So we need a little more strength and a little more muscle. All right. This blood up here in the right atrium, it only has to travel down here. So we don't need a lot of muscle, not a lot of thickness. So that's one thing you'll notice, certainly. Oh man, if we were together and we'd do heart dissections, we dissect pig hearts. Darn. Shoot. Well, if we ever get back onto campus in Elkhorn or Burlington, and I'm around, just stop in and I'll pull out one of the hearts and show it to you. Seriously. Anyway, right ventricle. If I have a pause here, yeah, real quickly. Again, registration's opening up for next semester. If they have a letter other than a W, those are going to be, at least for now, face to face for 2 hours a week. So if you're in one of my advanced face to face or 2 hour a week kind of hybrid classes at Elkhorn, I'll pull out a heart and we'll take a look at it. But anyway, pictures in 2 dimensions don't do it justice. But I think initially when you're being introduced to the basic structures, I think illustrations work very well. So anyway, we're going to leave the right side of the heart finally. We have the right ventricle. We just made it past the tricuspid valve. As we leave the right ventricle, we're going to pass through another valve. And again, these are there to prevent backflow. And where are we going with this blood that's in the right ventricle? Remember, the right side of the heart is pumping blood over to the lungs. So pulmonary is your magic word for relating to the lungs. So we're going to see a pulmonary valve. Okay, a pulmonary valve is going to leave that right ventricle and open up into what we call the pulmonary trunk. Okay, and again, this is all low oxygen blood. That's the whole point of pumping it over to the lungs. Okay. They also have, so pulmonary valve. Okay. They also put the word semilunar valve or semilunar in between pulmonary and valve. So, semilunar means partial moon shaped. So they're partial moon. So semilunar, they have a little bit of a cup, kind of a moon shape. So that's where that's where they get that term. But anyway, right ventricle pumps and contracts, and the blood's going to pass through the pulmonary valve, enter into the pulmonary trunk, and at that point we're going to move over into the left lung or the right lung. So the blood's going to leave the heart and it's going to split. Some of it's going to go into the right pulmonary arteries, some of it's going to go into the left pulmonary arteries. So that's what we see going on here. Then we get our capillaries and our pulmonary capillary network exchanging the oxygen and carbon dioxide. So now we've got oxygenated blood. we need to send that blood back to the heart. This time, though, it's going to go to the left side of the heart. And again, blood that's going toward the heart is going to be in a vein. Since it's coming from the lungs, would call it pulmonary veins. So the pulmonary veins, the only veins in the body bringing blood high in oxygen to the heart, are going to dump that blood into, you guessed it, the left atrium. Yeah, remember the atria are the top chambers. So the left atrium is going to receive all of that oxygenated blood from the lungs via the pulmonary veins. And then again, just like almost a mirror image to the right side of the heart, we're going to have another AV valve, what we call an atrioventricular valve. And that AV valve is called the left atrioventricular valve. They also give it the name mitral valve. They also call it the bicuspid BI. So we have the tricuspid on the right, the bicuspid is on the left. So, and the left has another term called mitral valve, and you've maybe heard that. That's a clinical term. A prolapse is when a valve is not closing properly, and so we get blood backflow. So if a valve is improperly is working improperly, or I don't, if a valve ain't working, then things are going to go backwards. That's what I'm trying to say. So if this valve, this mitral valve, has a prolapse or a dysfunction to it, then as soon as the left ventricle contracts and ejects blood out to the body, if this valve doesn't close, then we might get backflow of some of that blood back into the left atrium. And then that can have an effect going all the way back to the flow into the lungs. Could lead to some congestion in traffic, certainly. All right, so we need to fix a valve that's dysfunctional, because if some of the blood that's supposed to be, because it's all about volumes, right? So there's a certain amount or a certain volume that gets pumped out every second, and then therefore every minute, and that normal volume, we call it cardiac output. That normal cardiac output is a range, and if that cardiac output isn't enough, then the heart has to beat faster, right, to get more blood out. And so if we have a prolapse, then it could lead to the heart compensating by beating faster, and then that puts more wear and tear on the heart muscle. And so anyway, yeah, so mitral valve, they actually use pig valves sometimes, or cadaver valves, to do valve repairs. Yeah, wonderful, huh? So anyway, AV valve, left AV valve, also known as mitral or bicuspid. We're finally into the left ventricle. Notice the blood is red still. We also see a very thick wall. It's the thickest wall. You may be asked, which chamber of the heart has the thickest, most muscular wall? That's always going to be the left ventricle, because the left ventricle has to pump all of this blood out to the body, all the way to the tips of the toes. Of course, gravity helps, right? When we're standing upright, but regardless, this left ventricle pumps with a lot of force. So we do see a thicker wall on the left side. Uh, we're going to pass through another valve as we leave the left ventricle. Just like when we left the right ventricle, we went through the pulmonary valve. As we leave the left ventricle, we're going to pass through the aortic valve. So blood that left the right side was going toward the lungs. So we had the word pulmonary. Blood that's leaving the left side of the heart is going to enter first into what we call the aorta. And you can see that term all the way up here. Aorta is the largest artery in the body. It's the largest, probably the largest blood vessel. It's not the longest blood vessel, but I think as far as diameter and strength and surface area, I think the aorta, because it's more than here, the aorta actually descends and goes all the way to right around the area behind your belly button. and then it kind of branches off. So we'll see that next week in more detail when we look at the vascular system and the different arteries and veins of the body. But keep that in mind. Yeah, the aorta is pretty massive. So that's the first stop for blood that's leaving the left side of the heart. We're going to go through this aortic valve, just like we did over here, pulmonary valve. And then once we're past that aortic valve, we're into the aorta. Okay, and at that point, they call this and the aorta has different sections. So we'll see that more next week. I don't want to get uh, too far ahead, but yeah, the for now we're just going to call it the aorta. Okay, and you can see there are a couple vessels up at the top. These are going to go up to the head and out to the arms. Okay. Whew. So that's your basics of your heart. We're going to look at a few more slides. You're not quite done. We're pretty close. Okay. Superior vena cava, inferior vena cava, dumping into right atrium. Open up that tricuspid or right AV valve and go into the right ventricle. As we leave the right ventricle, we have to first pass through the pulmonary valve before ending up in the pulmonary trunk and pulmonary arteries. Okay. Then we come back and go out to the lungs and then back to the left side of the heart and again into the atrium or the top floor, the left atrium, okay, via those pulmonary veins, left atrium, left uh, uh, AV valve or mitral valve or bicuspid valve into left ventricle through that aortic valve and into the aorta. So right side versus left side. Right side in this situation, unlike the crazy political world that we also live in, which is kind of like a pandemic in and of itself, probably. But anyhow, yeah, right side of the heart is blue. Left side of the heart is red. So left side of the heart is pumping oxygenated blood out to the body. Right side of the heart is pumping low oxygen blood to the lungs. Okay, so that's what's going on there. A couple other little key items of note. Again, we do have the heart is protected. It's encased in a kind of a double layer membrane called the pericardium. So we do see what's called the fibrous pericardium, and then what we call the serous pericardium. Okay, so the fibrous pericardium and the serous pericardium. Now, the fibrous pericardium, fibrous, just like it sounds, means there's a lot of fibers involved. So it's going to be the most superficial aspect of the pericardium. It's going to be what's kind of intrinsically connected with some of the surrounding tissues from other organs like the lungs or the diaphragm. So fibrous. So there's going to be kind of a strong outer layer of a sac surrounding the heart. And then we go a little bit deeper from that fibrous pericardium, and we end up with what we call the parietal pericardium. And that's going to be what we call the serous layer. So we basically have a fibrous membrane and then a serous membrane, and the serous is a double layer. Anyway, serous implies that there's a serum or a liquid involved. Okay, so fibrous tells us there's strength needed. Serous tells us there's a serum or a liquid involved. All right, so the parietal is the more superficial layer of anything, and visceral is the deeper layer of anything. Typically, we would see the visceral layer of something right up against the organ or the viscera that we're talking about. So we have this parietal pericardium, and then we have, and again, that's going to be connected with the fibrous pericardium. Okay. And then we have a cavity, pericardial cavity. That's where the serous fluid is. It's the serous, the serum. We call it pericardial fluid. Nothing fancy there. And then we have what we call the visceral pericardium. And the visceral pericardium, again, viscera means guts. So visceral anything means we're talking about the guts. So the visceral pericardium is going to be the layer right snug against the heart. In fact, when we dissect the pig heart, we can't really distinguish the visceral pericardium from the myocardium very well. So the visceral pericardium is I mean, it's snug up against the heart. Okay. We also call this the epicardium. We've seen this before, right? Remember epithelium, epidermis, epimysium, epiphyseal, epineurium. Okay, so epi means upon. So the epimysium or the epicardium is going to be synonymous with visceral pericardium. So they call it the epicardium or the visceral pericardium. And then you have the thick part of the heart we call the myocardium. Myo means muscle. So the muscular layer. And then finally, the innermost layer, which is going to be kind of the lining of the chamber of the heart, we call that the endocardium. So anyway, endo means inside of. So the endocardium is the lining, the inner lining of the chambers of the heart. And then the thick muscle layer, that's called the myocardium. And then the outer layers, again, it's still connected with the heart. It's called the visceral layer or the epicardium upon the cardium. And then there's a little uh, cavity, and then you're going to have the fibrous and the parietal pericardium. So the hearts we dissect come with all of it. So we have to remove the fibrous pericardium and then the parietal pericardium before we can see the heart itself. Couple of items on here that I want to show you. We're looking at an anterior view. This is an anterior view as well, but we did kind of a coronal cut or a frontal cut and removed the front of the heart so we could see inside of it, right? So now we put the cover back on, and now we can see the heart superficially without looking inside of the heart. We're not seeing the chambers. Whew. Little sneeze. So anyway, so we're just looking at the outer, most superficial aspects of the heart. Yeah, we can see the right atrium, and then the real muscular aspects of both ventricles. Now, how do I distinguish right ventricle from left ventricle? Well, one thing I'm going to look for is what's called the apex. The heart, the ventricles kind of come to a point or an apex, and in the bulk of that muscular apex is going to be part of that left ventricle. So you can see that there. And over here, you've got a little bit of the right ventricle. Oh, and I wanted to mention real quick back to this one, right? And it's not labeled. We'll see the label too, but we do have a wall here. We have a septum or a wall. We don't want this blood mixing, right? We don't want low oxygen blood coming over here and getting pumped out to the body because we just got it from the body. We need to get it to the lungs. And we don't want high oxygen blood ending up over here because it's going to go to the lungs where it just came from. It can't get more oxygenated. So we do want to maintain that complete wall or septum. So anyway, a couple of other items. Again, I mentioned we do have these coronary arteries and cardiac veins. For now, you're not really responsible for having to know these. Let's see, inferior and superior vena cava, you know those already, and aorta we talked about, and the pulmonary trunk, pulmonary arteries, pulmonary veins. So those are the main items. This has a lot more stuff on it than you're going to need to know for right now, for today. Next week, we'll get into these guys up here, some of the blood vessels in more specifics. But for today, just knowing and being introduced to the basic big the great vessels of the heart. So we've got, again, the two vena cavae, and then we've got the pulmonary trunk and pulmonary arteries. Then we've got the pulmonary veins and the aorta. Those are the primary vessels for today. and then knowing the 4 chambers and the 4 valves, right? We have 4 chambers. Okay, we have 4 valves. Right atrium, right ventricle, left ventricle, or right atrium, right ventricle. Okay, and then the valve. So it goes chamber, valve, and then out, right? Atrium, AV valve, ventricle, and then some sort of a semilunar valve, whether it's the pulmonary or aortic. Okay, so chamber, valve, chamber, valve, chamber, valve, chamber, valve, chamber, valve. So just know those. And it's just right side, left side. Atrium on top, ventricles on the bottom. AV valve in between the atrium and the ventricle on the right, AV valve between the atrium and ventricle on the left, and then 2 valves as we leave the heart. Okay. And there's a posterior view, same thing. You see the vena cava, inferior vena cava, superior vena cava, all dumping into the right atrium. And then we see those pulmonary veins dumping into the left atrium. This is a posterior view looking at the heart from the back. Then we've got some musculature, of course, the actual, the myocardium layers. And again, we'd see the atrial musculature is really just kind of there to give a little bit of a squeeze around those chambers to get blood ejected down into the ventricles. Now, the ventricles, notice they're a little more complex with the way their musculature is arranged, because they need to create a lot more force to eject blood out to the lungs and certainly to the body. When we look at a cross section of the 2 ventricles, we see that, again, the right ventricle muscle wall is quite a bit thinner. It's still pretty thick, but relative to the left ventricle, we see, again, a lot thicker muscle wall. So the right atrium almost looks like it's a bigger chamber. Okay. And then on a contraction, again, you can see the musculature layer gets thicker as blood gets ejected. Okay, now we're almost done. I just want to mention a couple more items that of interest. One I already mentioned, the septum that divides the 2 ventricles. We call it the interventricular septum. Okay, when we look at the 2 AV valves, so we see the mitral valve on the left, the tricuspid valve on the right. We also notice there are little cords, little kind of puppet strings coming off of those. Those are called Chordae Tendineae. Chordae Tendineae. Okay, those are little puppet strings or little cords that are attached to the valves. And then these valves are going to be attached, or these puppet strings, these chordae tendineae, are attached to these little bumps. So you can see a little bump here, a little bump here. There's another one down here, more of them in here. These bumps are called papillary. Okay, we've seen papillary before. Papillary means bump. Okay, papillary muscle. So kind of the lining of the inside of the ventricles is not smooth. It's got little papillary, little bumps, and these papillary have multiple cords attached to them, and these cords ultimately are going to be one with the valves. Okay. So that's part of how we get the valves open and close, is by the positioning of these ventricles when they are relaxed or contract. Okay. So remember, when I eject blood out of the ventricles, like we see on the right side there, when blood's leaving, we have to make sure that these valves are closed. So again, these cords play a role. And then when would I need this valve to open? Well, as this muscle relaxes, right? As the ventricles relax, that means they're ready to receive more blood. So as they relax, we can see these puppet strings get pulled on a little bit. That's going to pull the trap door open. We'll get a little bit of a contraction of the atrium, and then blood comes right down through. And then you can see the semilunar valves, the pulmonary and aortic valves. Okay. So on this slide, really haven't added a heck of a lot. Added mainly, I would say, three things: the interventricular septum, the chordae tendineae, and the papillary muscle, or the papillary aspect of the cardiac muscle. Just put papillary muscle. Okay, that's all we added. We've already done the vena cava, the atrium, the valves, the chambers. Okay, so we just added a couple more things. You can handle that. And there they are. This is an actual dissection of a heart. You can see again these chordae tendineae, and then these big bumps, these papillary muscles. You don't need to worry about the trabeculae carneae. Okay, don't worry about those. Just these top two: chordae tendineae and papillary muscle. Okay, so kind of a bird's eye view or a superior view with the atria cut. We got the atria out of there so we can see, again, the tricuspid valve. So this is the right side. So this is anterior view, posterior view, right side of the heart, three cusps. And over here, the left AV valve, the mitral valve, is two cusps. Okay. And then we look at the semilunar valves. The aortic valve and the pulmonary valve look very similar. They have three flaps or cusps, and they're cupped. You're going to see that right there. So there are actually three of these little cups that come together, forming the semilunar valves. That's pretty much it. There's one other item. So you can see the mitral valve open and closed. So when the tricuspids and bicuspids are closed, then we're not getting backflow into the atria. We need blood to be leaving the heart. So we see the two semilunar valves open. Okay. And then when the two AV valves are open, it means the ventricles are filling up. So we can see that down here. Ventricles are filling up, mitral valves open. Close these up. Okay. Then we eject the blood. Blood travels through the aortic valves. We close the AV valves. And again, this is a little bit getting into a little bit of physiology. So, but I did kind of want to show you what we see going on with these valves opening and closing. Okay. And then lastly, we didn't talk about it at all. I do want to mention it though. It's not really in this chat. It's in chapter 19, but it's in the later chapters. It has to do with the electrical aspects of the heart. And again, we're not really required to talk about conduction and how the heart beats. We're not really into that yet. We'll get into that next semester, but I do want to mention that the vagus nerve, remember, does come down to help with that parasympathetic normal rhythm. We call it the pacemaker of the heart. So we do have what's called a pacemaker in our heart. They call it a node. And then there's another node called the AV node. And then we'll see so basically you've got a little bundle of nerves here, and then they kind of branch out into here. So to get the heart to contract, what do you need? You need electricity, you need voltage. So that's all a side note. You're not going to be quizzed or tested really on the nodes or the electrical aspects of the heart. You may see a couple terms, but that's it. You've got plenty of terminology to worry about. That's all I have for today. You guys have a great weekend. On Monday, we're going to get into, hold on a second, let me exit this. I'm going to stop recording.